Okay, first thing I'm going to do is just examine the outside of the vulva and make sure that the anatomy is normal. I'm looking at the mons. I'm looking at the labia majus. I'm looking at the clitoris and the prepuce over the clitoris. I'm looking at the urethral meatus. I'm also looking at the labia minus, the hymeneal ring, the perineal body, as well as the perianal areas. I want to make sure that the architecture is normal. There are some vulvar processes that can eliminate the normal architecture. I'm looking for lesions, masses, redness, increased vascularity, etc. Then I'm going to do the Q-tip test. I'm going to let the patient know that I'm touching out on the thigh. Most patients won't have discomfort out in this area, but this kind of keeps them from jumping off the bed. So you're going to feel my touch out here on your right thigh and your left thigh. Next, you're going to feel pressure on the outer lips or the labia majus. Do you ever have pain in this area? I'm going to touch on the clitoris. Do you ever have pain here? Next, I'm going to touch on the inner lips or labia minus. I'm going to touch on the interlabial sulcus, or the space between the inner lips and the outer lips. Next, I'm going to touch on the periurethral area. And then lastly, I'm going to touch on the vestibule right at the hymen. This is the most common place where people will have provoked vestibulodynia. I'm also going to touch on the perineum, and I'm going to characterize where the pain is. Next, I'm going to put gel on my fingers, and I'm going to insert my fingers. I'm going to feel the levator muscles, both on the left and the right. I'm going to feel back near the sacrum. I'm going to feel where the rectus muscles insert into the pubic symphysis bilaterally. And I'm going to feel the urethra and bladder, characterizing where there's pain. Lastly, inserting the speculum, examining the cervix, the vagina, making sure there are no lesions in the vagina and that the cervix appears normal. Oftentimes we will perform a yeast culture. We perform the yeast culture using the GVS swab. We get the labia majus inside the vagina as well as the perianal areas. We send that for yeast culture and order sensitivities if the yeast grows something positive.